enter a brand new plan by a Republican. And that Republican is Congressman John Shadegg of Arizona. He is my guest this morning. Congressman, good morning to you.
Glad to be with you, Megan.
All right, so you've got the white hat on, and you're riding in on your white horse, and you're going to save health care reform. What are you proposing that the other 5 plans that are already on Capitol Hill do not propose?
Well, it's called the Improving Health Care for All Americans Act, and what it does that no other plan, at least that the majority is putting forward, is it gives you, the individual, choice in health care. It does provide the ability for every American, regardless of income, to buy a health care plan of their choice. Those who can afford it will buy it with their own money and get a tax offset for doing so. Those who can't afford it get a tax stipend to be able to go out and buy a plan, but they buy a plan of their choice. And the reason for that is we want to promote competition in the healthcare market, and we want to give individuals choice so they can control their healthcare. Right now, your employer controls your health care. Your employer selects your health care plan. That plan selects your doctors. You're kind of cut out of the process. In the absence of competition, prices keep going up and up and up, and quite frankly, quality comes down.
So are these people, though, are these people who are going to get the government money, the people who are too poor to afford it on their own, so the government's going to give them a check, basically, to go out and buy health care coverage? They're not going to have a government option under your plan? It's all going to be from private insurers or a co-op type thing?
No government option. They'll have many more choices. They'll be able to take their employer's plan or go buy a plan on the open market, and we create more insurance pools so that you wouldn't have to take an insurance plan offered by your employer. You could take one from your alumni association or the Daughters of the American Revolution or the Rotary Club International.
Well, how do you get that through, Congressman?
Plans.
Because you know the Democrats, they want that public option. I mean, it was so interesting because we saw Barack Obama, through his White House chief of staff, come out earlier this week and open the door, at least, to not having a government option. Then there was so much outrage from the liberals about that you had President Obama from Russia issuing a statement out to the media saying, hold on, I want a public plan, we're having a public plan. You don't have the public plan. How on earth are you going to get your plan through with the Democrats?
Well, quite frankly, I think getting our plan through would only happen if the American people speak out and say they want choice and control. They don't want a government bureaucrat telling them what health care plan they can have. And that's exactly, I mean, you're exactly right. The Democrats in Congress are saying there must be a public plan, but more than that, they're saying the government must decide what every health insurance plan in America controls. Indeed, I think you can summarize their bill with one sentence. If you like what you have right now in terms of your health care plan or your health care coverage, be prepared to lose it. Be prepared to lose it, because you're going to lose it. The House bill says every single plan in America will change within 5 years because they will have to be approved by a newly created government bureaucracy that will say what your plan has to look like.
Congressman, is this going to happen? You know, I mean, listen, you know you're in the minority party. Your bill probably not going to get through unless you say the American public rallies behind it. But let me ask you, but they are worried, a lot of our viewers, about the Democrats' bills going through and exactly what you just predicted would happen happening. So is this actually going to happen? Do you think this bill gets through this summer or early fall, the Democrats' bill?
It is the most sweeping change or the most sweeping piece of legislation in decades in Congress, and yet the majority party and the White House are saying, by God, it must happen. I heard just this morning that they're talking about putting off the August recess to make it happen. Again, if you like what you have, be prepared to lose it, because they are saying it's going to happen. I think the only way this bill doesn't happen, given the significant majorities that the Democrats have, or the majority has in both the House and the Senate, is if the American people get a chance to see the bill and speak up. And right now they're rushing so quickly to get it done that I think there's a little chance the average American will get to see what's in these bills.
Congressman John Shadegg, thanks so much. We appreciate you coming on.
My pleasure.